Hello, I'm Dr. Syuhaida and this is Dr. Eugene and we are both a practicing psychiatrist in Malaysia. So today we would like to talk about a little bit on depression and in Malay we commonly known as kemurungan. So yeah, Dr. Eugene, can we start with the first question? Yeah, can you tell me what is exactly depression?
Hello, everybody. So, depression is actually a psychiatric condition where a person or an individual starts experiencing low mood or sadness almost on a daily basis, or they start losing their sense of pleasure from things that they used to do. So, for instance, if they used to have hobbies that they like to do, and suddenly they don't feel any more pleasure out of it. And these feelings will actually go on for at least 2 weeks or more. And that's how we will know the basic idea of a depression. Of course, depression comes with other forms of symptoms and signs also. There will be things like you have your appetite changes, you just don't feel like eating as much as usual, or you find that your clothes don't fit as much because you have lost weight. Focus becomes problematic. You're unable to focus at your day-to-day tasks, and you would also experience things like you get more angry easily. You might start blaming yourself. You feel that your self-esteem has dropped, and you might even end up having difficult thoughts like wanting to hurt yourself or hurt others. Um, so these are just bits and pieces of depression. It's not always the same picture for everybody. Everybody experiences depression differently. Some of them will experience all the symptoms we talked about just now. Some of them will just experience bits and pieces of it. And of course, all of these symptoms, all of these signs and symptoms will actually bring on problems to their life. The individuals will not be able to carry out their day-to-day activities, and their relationship with their friends, their family, their loved ones will also inevitably be affected.
So, Dr. Eugene, so it means that the depression is not like the normal stress that we used to face every day. So, when do I seek help if I think I have a depression?
So usually, as we talked about just now, depression comes in a wide range of signs and symptoms. It also presents in people differently. And what muddles it or makes it a bit more difficult is that depression is a term we throw around very easily. Sometimes we're just feeling a bit low. We are not actually experiencing depression, but we call it depression, and then everyone starts worrying that could this be an actual mental illness. How I would actually approach this is to actually ask yourself, these symptoms, these things that I'm experiencing, how is it affecting me? Is it to such an extent that I'm unable to care for my loved one anymore, or I'm able to work productively? I just want to keep alone. I want to isolate myself. Or is this just something temporary as a reaction to something that has happened immediately, as Dr. Syuhaida mentioned just now, a form of a reaction to a stress? If it's the later, as a form of reaction to stress, that means something recently happened, resulting to you experiencing not quite yourself. Maybe you just need to find um, help, self-care help. Do things that would perk you up a bit, do things that will recharge you. Maybe talk to someone, a friend, someone from a religious body, see whether would that help. However, if your condition is like the first part where it's actually affecting your relationship very badly, you are unable to carry out any of your day-to-day activities, and it's causing a lot of negative impact, then I would suggest that you actually seek professional help.
Okay. So, when you said that you would suggest for help, so it means that it is a professional help, right, Dr. Eugene? So, what exactly is the professional help that I can get if I do have depression?
Um, you could actually go and find help by going to your nearest GP or your clinic kesehatan and talk to them. Those doctors would usually be able to advise you on how to seek further professional mental health support. However, if you're not comfortable with that, you can even approach religious bodies, supportive bodies, like for instance, talking to your ustad, your pastor, and they are usually experienced enough to be able to direct you on where to go in terms of help seeking. In with regards to professional help, when we usually talk in mental health, we have three common professions. We have your counselors, we have your psychologists, we have your psychiatrists. All three fields work within mental health in a very different manner, But all three aims to be able to assist you if you do have depression. Treatment could consist of maybe medication or psychotherapy, or what we commonly known as talk therapy. It could be a combination of both. It could be just one of those. Again, it depends on the advice of the professional help whom you're seeking to, and they will be able to advise you more. If you'd like to find out more about counselors, psychologists, and psychiatrists, there will be a video within this YouTube channel where you can click on and view up more, and we will actually invite professionals from those fields to discuss more in the future. Okay.
And well, thank you so much, Dr. Eugene. So I think that's a very simple and informative um, information on depression. And I hope that we will learn something about this, and it is very useful for the viewers. Is there anything that you want to ask more about the depression? So feel free to leave your comment into the comment section, and click like if you like to watch further videos on this, and subscribe more to this channel for more similar videos like this. All right.
With
So we
that,
would like to also have a Malay version of this to talk about the depression, and with the video, and we will send the link of it. So with that, I thank you and goodbye.